give a gram of Ancef, which is in a 50 ml bag. We're going to give that over 30 minutes, so we'll go through those steps. So again, we have our provider orders right here. So we're confirming that it's 50 mLs of Ancef, which is the 1 gram over 30 minutes every 8 hours. Now this is for Ellen Davis, date of birth 9/1963, no known allergies. Going to confirm with the patient. Ms. Davis, make sure she identifies with at least 2 identifications, so name, date of birth. Going to look at her patient band just to make sure that it is the right patient, right date of birth, confirm no allergies, mark that against the provider orders and what the patient's saying, so I know that I have the right patient. Then I'm going to continue on with the 6 rights. So now we have the right patient. We're going to make sure that this is the right medication, the right dose, the right time, the right route, the right documentation, and again, the right patient. So we have 1 gram of Ancef. We're going to check the expiration date, which is 6/22, so we can still use this. We're going to look at to make sure that there's no discoloration, no particulate matter, make sure that it's not opened, anything like that, so we're ready to go. As far as that goes, again, we confirm no allergies. Before we do anything, we're going to make sure that the IV from the infusion that was started, that there's still no infiltration, that there's no issues with it, no redness, swelling, tenderness, no complications so far. So once we know that there's no issues with that, we're going to explain to the patient this is an antibiotic that you're receiving from the doctor, ask if there's any questions, educate her on some of the side effects, why she's receiving it, how long it'll take, etc., how often she's going to get it, and so forth. We did the math for this one, so we want 50 mLs. It's a 10 drip set over 30 minutes. So we have this. So we have the volume times the 10 drip set, so 50 times 10 divided by the 30 minutes, which is 16.666667, so right around 17 drops per minute for that math. So it's the same formula that we used before. So once we do that, it's going to be 1 drop just about every 3.5 seconds. So we confirmed our 6 R's, we confirmed our patient, date of birth, name, no allergies, multiple times. We have our provider orders. So now we have all our equipment. We're going to label the infusion with the patient name, date, date of the infusion, prescribed infusion rate, the time that it began, and completed time. So we have Ellen Davis. We'll have the date of today, my initials. It's 50 mLs. It's a gram of Ancef, and it's going to be a start time of 14:30, so we'll end at 1500 because we'll be over 30 minutes. So we're going to get our drip set, which is the 10. Again, make sure you're keeping all the covers on when you need to. You want to keep this as sterile as possible. Before all of this, like I said, we have proper hand hygiene. So as we set all this up, we just peel that back. Again, take the cover off of the spike. Make sure you're not touching anything. You're going to make sure that's in. You want to make sure that the roller is shut off before you do any of that. Make sure that this isn't all twisted. And you're going to prime this the same way. So we'll fill the chamber halfway. So you can squeeze that so you can see it. Again, if it's filled too much, then you're not going to be able to count the drops, which you need to do. So we're going to make sure that the line is primed. So we're going to, because it's the secondary, it's going to be higher than the primary. We are going to make sure that we prime this. Now make sure you're cautious with this because it is medication, so you don't want to lose too much because you need to get the whole recommended dose. Again, we have the cover on here, so it's still staying sterile, so it hasn't touched anything, so we don't have to worry about that. So once we have that done, we set up all of that, we labeled it. We're going to also label this line, just so again, because we have the secondary, we want to make sure that we're not confusing them, so we know primary, secondary. We can look at any time to distinguish what line is with what medication. We're going to take another alcohol prep. You can throw that out, make sure you're not touching anything with this. As far as the line, it's going to be the port closest to the primary. This one only has the 2 ports. One is a needleless system, one's a needle system. We're using the needleless, so it's the thread. We're going to clean this for at least 15 seconds with this alcohol. We're going to make sure that it air dries. We're not going to fan it or anything like that. Once it is dry, we're going to take our infusion line. This cover's still on it, so it's still sterile now that this is dry and cleaned. We're going to thread these together to confirm, so that's all set. Secure that line. And now at this point, that's already open. We already have this infusion going, but now we can open up this. Now we have to make sure that it's at the correct drop per minute. So again, it's going to be 1 drop every like 3.5 seconds or so. 1, 2, a little too fast. So a drop, 1, 2, 3, and a half. If you, obviously you'd use a clock or a watch to get a better, or a tape that you can use just to make sure that you're getting the proper dose. Again, once you get that infusion, we have that at just about 17 drops per minute. We're going to secure everything, assess for over 15 minutes, make sure there's no adverse reactions or any other interventions we needed, continue to check vitals. At this point, we can get rid of our trash. We are going to perform hand hygiene. Again, educate the patient if she has any questions. Put the patient in a position of comfort because at the beginning we put the rail down, we raised the bed. So now we're going to make sure the rail's back up,